Health Insurance Open Enrollment Get Answers is a production of UNC-TV in association with the North Carolina Hospital Association.
If you're a small employer looking for health insurance, look no further than the SHOP Marketplace. The Small Business Health Options Program, or SHOP Marketplace, is where small businesses find and enroll in affordable, flexible health insurance for their employees. We make it easier for small employers to offer high-quality health and dental coverage to employees. You may even qualify for a special tax credit that'll lower what comes out of your pocket. Here are some quick tips about the SHOP Marketplace. It is specifically for small businesses. It's generally open to employers with 50 or fewer full-time employees, including religious and nonprofit organizations. And you can start offering coverage any month of the year. It's online and available when you are. Healthcare.gov has dozens of resources to learn more about eligibility, tax credits, and coverage options, and lets you enroll and manage your coverage any time of day that works for you. It puts you in control. You decide how much to contribute to premiums, when to start enrollment, and how you want to offer coverage, like a single plan or choice of plans. Providing health insurance is an important business decision, and the SHOP Marketplace helps you make the best choice for your business. Registered agents or brokers can help you evaluate your options, choose a plan, complete your application, and manage your enrollment. This is all at no additional cost to you. Visit healthcare.gov to find a SHOP Marketplace registered agent or broker to get personalized support and help today. Ready to shop? Go to healthcare.gov/small-business and get started. As a small business or nonprofit, you may be eligible for the Small Business Healthcare Tax Credit, giving you the chance to put money back in your pocket. You may qualify for this tax credit if you have fewer than 25 full-time employees, provide an average salary of about $50,000 a year or less, pay at least 50% of your full-time employee-only premium costs, and offer coverage to your employees through the SHOP Marketplace. The tax credit is highest for companies with fewer than 10 employees who are paid an average of $25,000 or less. The smaller the business and lower the average wage, the bigger the credit. Still not sure if you qualify? Check out the Tax Credit Estimator on healthcare.gov to find out if your business may be eligible. Or call the SHOP call center at 1-800-706-7893. Ready to shop? Visit healthcare.gov/small-business.
Well, I'm going to throw this question out to all of you, and perhaps I can get an answer from one of you, but how will consumers who were part of other company plans this year be affected by the insurance companies leaving the Affordable Care Act?
So CMS is going to place customers of those plans into a new plan available in their area. For those members who are coming to Blue Cross, we do have a website available to them that's bcbsnc.com/hereforyou that consolidates information such as network information, find a drug, other plans and benefits data that I think will be helpful. They can certainly go out to healthcare.gov and check out their options, but they will be placed into a plan and we'll proactively reach out to them once we're able to.
And of course, we've been hearing a lot that if you don't participate, that there are penalties involved. What are the penalties for those who don't enroll in the plans?
Just to add also to the earlier, for individuals, as the marketplace is changing in terms of their options, do go and look and see what might be available to you on healthcare.gov in terms of the assignments. So again, acting early is important. There is a penalty involved for individuals, and it is based off of either a percentage of income or a flat fine, depending on which is greater. So we don't want anyone to be penalized. Get covered. Go look at your options, and it really depends on your income and depends on your family size what that penalty is. It can range as much as $695 for an individual, up to more for a family. So check out those options and act early to avoid that penalty and to get covered.
Yeah, because that would be interesting to have to pay a penalty and still have to get the coverage. So.
Yeah, be uninsured. I think it's $695 per adult that is uninsured in your family. So you could have multiple adults that are subject to the fine because they could have gotten help online on the healthcare.gov. So much better to check. In terms of the companies that are leaving, United and Aetna are leaving North Carolina's marketplace. And Cigna is coming in new, and that changing of providers in the marketplace does happen from year to year. So again, we encourage everyone, they will be getting letters if you had been with United or Cigna, or United or Aetna. You will get letters from the federal marketplace telling you that there's a new plan out there that we think is similar, that you might want to check out and that we'll move you to if you do nothing. We really, really highly encourage people to actively look at all the plans available. On average, even if you only have Blue Cross plans in your county available to you, you're still going to have multiple plans that you can choose from. And you want to make sure that the plan you pick is the one that's best for you based on what you know about your own health needs and your budget. And the federal government doesn't know you individually. They're just looking at the plans generally, and they're going to say, oh, this United plan looks really similar to this one Blue Cross plan, so we're going to take everybody on that United plan and move them here unless they tell us to do something different. So we really want people that have to move from insurers, and really everybody who's already enrolled this year and needs to re-enroll for next year, to go look at the options, because the plans and the prices change every year, and they want to pick the best one for their personal needs.
Now, in addition to you, panel of experts, we've also received questions from people online, and here's one, and I'm going to address it to you, Sorian. A viewer had written, I read that insurance premiums are going up. We've been talking about that. Will plans be too expensive for me to afford?
That's a very good question. There's a lot of news that covers rate increases that may be occurring in individual plans or even employer-provided plans. On the individual marketplace, as I said earlier, 92% of North Carolinians getting a plan there are getting help paying for it, and that financial help increases when the rates increase. And so everyone, whether they're getting a plan now or they're coming in for the very first time, needs to go to healthcare.gov, update their information so they get the most up-to-date financial package available to them, and so that they also can choose between the different options and plans so they pick the right one, both for their health needs and their budget needs.
Now repeat that again. Where can consumers go to find out or to get help with plans for the Affordable Care Act?
Right. You can go directly to healthcare.gov, which is the marketplace, or you can go to call the North Carolina Call Center to get an appointment with a free expert assister in your county, and that number is 855-733-3711.
Health Insurance Open Enrollment Get Answers is a production of UNC-TV in association with the North Carolina Hospital Association.